First of all, thank you, Dr. Carter and Dr. Olivier, for inviting me to speak today. And truly, Dr. Melendez, your talk was just excellent. I am tasked to talk about a career in academia. I should first apologize that I'm actually at the Washington, D.C. airport, so you might hear some background information or music or talking. So I am considering a career in academia, and I've got a number of lists here, if you will, and I would summarize it just by saying consider a career in academia if you like being a student, because at the end of the day, you're continuously learning, you're continuously engaged, you're in an environment where you're both a teacher, but you're also always being taught. If you like intellectual stimulation, challenges, a lot of variety, an academic setting will provide that for you. If you desire professional freedom, an academic setting also provides that for you, especially if you choose to do research or pursue other interests surrounding academia. I think of my faculty as an example as all sort of independent entrepreneurs that have decided to live under one roof, if you will, but they have a great deal of freedom to pursue a research interest or educational interest. Consider a career in academia if you want to contribute to your field of ophthalmology, but also if you especially enjoy the university environment. There are some benefits. There are more than what are listed here. Mentoring, I believe that is multi-directional. You become the mentor, and you are always being mentored as well. Other one is being paid to learn. Again, as I said, you're sort of a lifelong student. Your schedule can be quite flexible. You tend to not have to see patients 24/7 or 5 days a week. There's time that's allotted usually with an academic position to pursue the other pillars of academia, that being education and research. There's a certain amount of gravitas or influence that you have as a teacher, as a mentor, especially if you develop sort of a niche area with expertise. And then, of course, another benefit of a career in academia is gaining tenure, which is both a status of, in terms of being in the field for some time and having garnered some recognition that your contributions have helped the institution that you're at, but also helped the field that you're in. But tenure also means that unlike say living or working in a company, you are garnered lifelong employment there, and that cannot be taken away except under highly unusual and exceptional circumstances. In terms of preparation, I think intrinsic motivation is really key. I'm going to perseverate on what that means before I go down the rest of the list. Intrinsic motivation refers to behavior that is driven by internal rewards. In other words, the motivation to engage in a behavior arises from within the individual because it is naturally satisfying to the individual. Extrinsic motivation, on the other hand, occurs when we are motivated to perform a behavior or engage in an activity to earn a reward or avoid punishment. So I would say extrinsic motivation is more to do with title, maybe financial rewards, status and power, perhaps publicity and fame. I think intrinsic motivation has more to do with meaning and purpose, service and duty, learning and growth. And in my experience, most individuals who I've encountered in academics tend to have more extrinsic motivation. Intrinsic motivation, they're more service-oriented. They like to be in an environment where there's learning and there's growth. They're learning, they're teaching, there's a lot of engagement. And I think it's important to balance extrinsic with intrinsic motivation because you can't control every outcome, number one. No matter how prepared or talented you might be, you can't control this element called luck. If you're purely extrinsically motivated, you might be setting yourself up for major disappointment when you encounter a competitive loss, some failure, or some setback based on factors that are outside your control. If you're intrinsically motivated, even if you suffer a loss or failure, you see the upside of learning from failure. You get fulfillment from the work that you've done, and you believe in a greater purpose and meaning from your activities. Another reason to balance the two is you don't want to be dependent upon what others may think about you. Your quest for external validation might drive your decisions rather than any kind of inner compass. So it's better to have inner confidence than external validation. And another point about intrinsic motivation is that you can take a longer-term view. External factors like your job title, your company's valuation, your fame, they could be fleeting. If you pay too much attention to them, you often worry about short-term changes in any of them. So if you're intrinsically motivated, when change happens or you encounter a setback in one area, you're able to take a longer-term perspective and remain optimistic about the future. The reason why I perseverate about all of this is that I think going into academics is exciting. I think it's been great for me, but it certainly had its ups and downs. And I realized what's sustained me is this, this sense of duty, this sense of service, the sense of finding meaning in being in an academic setting, both in terms of what I've garnered from it, but what I've also been able to give. And I just think it's really important to have that kind of motivation in order to, quite honestly, weather the ups and downs of being an academic. Other things in terms of preparation is being reliable and punctual. I think it was Woody Allen that once said that success is 99.9% reliant on just showing up. And I think that that's true. I mean, obviously, when you show up, you've got to, sort of give your opinions, not be a kind of bland in a committee. Do some of the work, do some of the hard work. But certainly, being there is a first step. Other preparation is mastering the material, working continuously to become the field expert in whatever field of ophthalmology you choose. Because when you do that, you become the go-to person for advice about that particular area. You get that recognition. You find others like you that you might find synergies in terms of research or educational collaborations. I would say volunteer to give presentations or teach a course rather than being a passive student, if you will. Volunteering gives you larger and larger platforms to teach, to also get better at that skill set, and also garners even greater recognition that you are the field expert in that area. I would use projects and writing assignments as opportunities to practice and receive feedback. Always continually write. The parallel to that is to always continually read the literature with the various journals that we have in our field, as well as in others. Work and learn with others. Work with advisors, colleagues. A lot of what you do in academics, just like in life, is teamwork. Certainly network. And at the end of the day, recognize that what you do and how you pursue it is a journey. And there's no formula or standard script. And the reason why I say that is now as chair of a department, and I've been chair for 3 years, I kind of look around and look at the other co-chairs in my institution at University of Wisconsin-Madison, but also chairs in other locations. And I started fairly late as a chair. I mean, and I've won't tell you my true age, but it was in my 50s. And many chairs are tapped in their 40s. And I think for women in particular, we tend to get a little stressed out and a bit, but more than greatly concerned about having fallen off the script, if you will, of garnering leadership positions throughout one's earlier career and having that ultimately lead to larger one's later career. I just found that my journey was a little bit more convoluted and didn't necessarily follow that of other male chairs, but nonetheless, things happen if you persevere, you have intrinsic motivation, you're reliable and punctual, you become a field expert, and you network and work and learn with others. So again, it's a journey, and there's no standard script for anybody. Everybody gets to that point by different mechanisms. So why did I choose a career in academia? I knew from grade school that I absolutely loved to be in a learning environment and never wanted to basically leave it. I had always done well in science and was a lab rat in college. Every year I was always in the lab during the school year, but also during the summers. I worked at, I think this is funny, I worked at Ford Motor Company developing and designing catalytic converters for 3 summers out of the 4 in college. I'm from Detroit, so it was a great gig if you could get it. But for me, it was really affirming that what I had learned in both high school and college, especially in chemistry, actually could be applied in a real way to real life question and need. And so I was just hooked at that sort of very science with real life problems. I stayed engaged in research work in medical school, and indeed took a year off doing a fellowship between my 2nd and 3rd year in cardiovascular pharmacology, which is a field I thought I was going to go into. Where I came back my 3rd year, and after finishing my required electives, did one in ophthalmology for a 2-week period at Massachusetts Eye and Ear Infirmary, and absolutely fell in love with the field. I love the fact that it's a combination of medicine and surgery. I love working with my hands. I've done a lot of sewing, quite honestly, for work and for money when I was in grade school and in high school. I actually made dresses for my mother and her friends. So I had a very sort of 3-dimensional mind, if you will. And so I liked using my hands. I like sewing. I like surgery. I like the fact that you can sit down while you're doing surgery. I like the fact in ophthalmology that you could do a lot of good in a short period of time for patients. I liked that it was a fairly happy subspecialty. Patients really were grateful, and it just felt right. So that's why I chose ophthalmology, and I liked, as I said, staying in an academic setting, which is why I chose a career in academia. At UW-Madison as chair, I still run a research lab in genetics, and I was fortunate to have a couple of my folks who were at Duke with me, my lab manager and research scientist, come with me. And now what I'm doing is basically helping that research scientist, a PhD molecular biologist, develop his own lab as a succession plan for him, for his work. And so this has been wonderful for me because I'm not only mentoring and guiding medical students and residents and fellows in ophthalmology, but also um, PhD folks too, and it's just really exciting to kind of pass on the baton to him. I think I'll stop here and entertain any questions.